and we will start with a Pledge of Allegiance. So we'll see how this will go. And I know I will imagine the flag sitting in the corner of my kitchen right now. So we'll start. 1, 2, 3. I pledge allegiance to the flag of the United States of America and to this republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are there any agenda adjustments this evening? Okay, we'll move on to the announcements. Due to the concerns regarding the community spread of COVID-19, Durham County government and the City of Durham have combined their stay-at-home orders. To read this order in detail, please visit the Durham County website, also the City of Durham website. You can also find frequently asked questions on both websites and lots of other information. Durham County is committed to providing resources for small business support, employment opportunities, and temporary changes in state, federal, corporate policy. Please visit the Economic Development COVID-19 resource page, also located on the Durham County government website. Again, there's lots of resources on the City of Durham and Durham County websites for business information. Also, the Chamber of Commerce and Downtown Durham Incorporated also has lots of good business information. And before I ask if other people want to share other announcements, I do want to add one thing to our announcements, which is a message about the census. As many people know, the census information was due to be completed on April 1st, 2020. We do have time to complete that information until, let's see, the date in August 14th is actually the deadline to submit your information. We fill out the census information every 10 years. This is the time that the federal government does a count of everybody who lives in the United States. It has nothing to do with whether you are a citizen or not. It's really about counting every single person who lives in our country, and for us, most importantly, everybody who lives in Durham County. And this census information is really, really important for North Carolina and for Durham County because it is the basis for distributing more than $675 billion with federal funding for everything from education, healthcare, business support, neighborhood improvement. And even a time like this, where we are relying on federal government help for COVID-19, a lot of that will be based on the census information. So we can really see how important it is for us all to fill this out. What's happening right now is that, unfortunately, as of April 11th, only 45% of Durham's response rate was only 45%, compared with Orange counties, which it was 55% on April 11th, and also Wake counties was 54%. And we know that we are aiming for an 82% response rate, and 10 years ago, in 2010, we only had a 75% response rate. So we are really asking everybody, especially when you're sitting at home and maybe have more opportunities to take care of something like this, please, please, please fill out your census information. It is, again, you do not have to be a citizen. It is nothing that is going to identify you personally, and you can do that online. You are also, everybody was sent an invitation in the mail, and there will be invitations that are going to be dropped off at people's homes outside their door on May 1st. Also, you can call 844-330-2020 to get information in English, or 844-468-2020 to get information in Spanish. There's also the ability to get help in, I think, 13 different languages by telephone, and 12 different languages online, and there are there's resources for 59 other languages, including American Sign Language, Braille, and large print. And Deborah, I'm going to ask you, since this is so important, anything else that you would like to add about trying to get everyone in our community to join in and fill out their census information? And anyone who's having trouble muting, I think you need to press ***, and then you can unmute your phone. So Deborah, I don't know. I think you're here, but if if not, we can move on. Just wanted to get. Okay, yes, we can hear you. Anything else you wanted to add about the census? Because I know you're one of the leaders of that effort.
So while you're waiting on Deborah, this is Commissioner Howard, Madam Chair. Can you hear me?
Oh, yes, go ahead, sure.
While you're waiting on Deborah, I just want to, for the citizens that may be on the line or may be listening, I just wanted to address them. I know that most of their commissioners seem to be missing in action lately with this virus, and they are not seeing most of the commissioners. I just want to let them know that we are here. We're trying to make sure that we stay safe, so that if we interact with you, that you are safe. And we are in the background just doing everything we can to make sure that our community is safe. And you're basically seeing one of your commissioners. You're not seeing all of us, but just we're all here. And also our system, technology, phones have been down, but just know that we're here for you. Thank you.
Commissioners, I apologize. My screen went crazy a little bit, but absolutely, it's important that we continue to press the message of the census to tell everyone that it's easy to fill out and that dollars count. Everybody in Durham gets $1,600 for services, for hospitals, for schools, for the things that we need right now during this COVID virus. So again, it's more important than ever that our citizens fill out that form.
Caretakers, are you there?
I'm sorry, did you hear me? I accidentally muted myself. Can you hear me?
Yes.
Okay, I'm sorry. Any other commissioners who wanted to share any announcements? And we will have time at the end of our agenda. I know the manager is going to give an update, and our public health director, because there's a lot of news to share that many people have been working really hard on, especially most recently the move of many people to the Marriott at RTP, our homeless residents, but we will wait until that part of our meeting to get into some of the reports on all the incredible efforts that our staff have been working on. Next item is our minutes. We have the work session from February 3rd, 2020. And before we take that up, I just want to say thank you to Maceo for those incredibly detailed minutes, and just to note that there were a lot of directives in those minutes. It was a very weighty work session with a lot happening. So thank you so much. So we have our regular session, February 24th, 2020 minutes.
Move approval.
Second.
Okay, I think I heard, was that Commissioner Howerton first?
Yes.
Okay. Moved by Commissioner Howerton, seconded by Commissioner Carter. All those in favor, please say aye.
Aye.
Aye. Any opposed? And the minutes are unanimously approved. Okay. Next, we have citizen comments, and I will read a number of comments that were sent in to us by email. The first comment is from Patrick Nally, 701 Lakeview Road. Commissioners, this is the time for the county to raise the tax rate. Durham County residents will need county services more than ever after the remission of the COVID-19 debacle. Every entity that relies on county support will need more support. Please put yourself in a position to provide that support. Okay, second comment is from G. Diane Wilkes at 533 Rowan Mountain Place, Raleigh, North Carolina. I urgently request that better access for the disabled and better efficiency and effectiveness related to access by the public be incorporated into the design of any new parking decks. New electronic technology is available which can assign spaces to avoid circling, which not only wastes time, but causes accidents by distracted drivers. Such an improvement would also improve the utilization of public services, as the public would be on time during heavy traffic times. Parking space assignment could be made when the driver checks into the parking deck, or vehicles can be stored by an automatic storage and retrieval system. Disabled citizens or the public at large could then access a moving sidewalk or either automatic system to get them to their destination more easily. I have also suggested this to UNC School of Government, Finance, with hopes that between the County of Durham and UNC School of Government, a better design can make better use of existing parking decks. This could also avoid building additional facilities by more efficient and effective use of existing facilities. For questions, I can be reached at 919-300-7989 or at the address below. And comment number 3 is from Justin Kretschmar, who works at Carolina Outreach, LLC. My name is Justin Kretschmar, and I'm a clinical social worker with Carolina Outreach in Durham, providing community-based mental health support to individuals with mental illness. I saw the press release from Friday about the approval of funds for the hotel rooms at the Marriott RTP, and that individuals in homeless shelters were being moved there. At this time, is there any way for individuals experiencing homelessness and are in the high-risk category who are not in a shelter to access this resource? I tried looking into the articles, press releases on this, and was unable to locate a specific contact or an answer to this question. I would greatly appreciate any clarification or direction on this. And I know that we did follow up with Mr. Kretschmar today, but Drew, could you please just respond to that question for anyone else who's also listening to that question?
Yes. This is Drew Cummings, Chief of Staff for the county. Individuals who would like to make contact with our homeless continuum of care should call our coordinated entry portal at 984-287-8309. Again, that's 984-287-8309.
Thank you, Drew. And could you also explain, Drew, just how this is, it's the same system that we've had in place. Nothing's changed.
Correct. So before the COVID-19 pandemic, that is the way that we welcomed individuals who were experiencing homelessness or worried that they might. That's how we would get their information and make sure that we had made the best referral for them depending on what services they needed and what available resources there were.
Okay, thank you so much. That completes the citizens' comments that we have received. We now have ceremonial items. The first is a proclamation for April 2020 as National County Government Month. And Commissioner Howerton, I had texted you, I don't know if you saw it, asking if you would like to read this proclamation.
Sure. Can you hear me?
Yes.
Can you hear me?
Yes.
Let's see, which one is that? The national government?
Yes.
Okay. All right, just 1 second, let me pull it up. So, proclamation, National County Government Month. Whereas the nation's 3,069 counties serve more than 300 million Americans by delivering essential and necessary services to create healthy, safe, and vibrant communities. And whereas counties foster economic opportunities, provide health services, administers justice, and keeps communities safe, and much more. And whereas Durham County, and indeed all counties, take pride in our responsibility to protect and enhance the health, well-being, and safety of our residents in cost-effective and efficient ways. And whereas under National Association of Counties, President Mary Ann Bogerson's leadership, NACO is demonstrating, and that's National Association of Counties, is demonstrating how counties matter, especially during this challenging era of the COVID-19 pandemic. And whereas each year since 1991, the National Association of Counties has encouraged counties across the country to raise awareness of county responsibilities, services, and programs. And now, therefore, I, Wendy Jacobs, Chair of the Durham County Commissioners, and on behalf of the Durham County Board of County Commissioners, do hereby proclaim April 2020 as National County Government Month in Durham County, where there are no typical
celebrations this year to highlight the work of the 27 departments. We urge all residents to honor their dedicated, loyal county government employees working for them every day. This is the 13th of April. Wendy Jacobs, Chair, Durham County Board of County Commissioners.
Thank you, Commissioner Howerton. And Deborah, I know you're the resource person for this.
Yes. Yes.
Is there anything else that you would like to say about this? It's fitting that we would be celebrating National County Government Month during this time.
Yes, again, this is Deborah Craig Wright, General Manager of Strategic Planning Innovation. I would like to thank you, Madam Chair, and all the board for allowing us to come before you this evening to celebrate our employees in county government. The theme this year is Counties Matter, and I can think of no better time to honor the work that all of our employees are doing. Clearly, they're on the front lines of this. Actually, Durham County is having two viruses. We're recovering from the malware virus, and of course, we are still battling, as are others, coronavirus. And so it's important that our employees understand that the work that they do is also critical throughout the county government, and we want the citizens to know that we are working on their behalf day in and day out, 24/7. Typically, we do some events to highlight some of the departments of county government. Clearly, that is not possible this time, and we also do a couple of social events to just recognize our employees. But I promise that when this is done, and we will get this done, we will honor our employees as they should be honored. And thank you for this opportunity.
Thank you, Deborah, and I think you really said it so well that, you know, we have many employees that are on the front lines, whether they are working out of their EMS or the office of the sheriff, or their social workers who are still making visits to people's homes, or they're filling out applications for food benefits, or they're working in public health. We have so many people that are just working around the clock in Durham County government right now to help people in our community. So thank you so much for bringing this to us, and I look forward to being able to celebrate all of the people in Durham County government.
Absolutely. Thank you.
Thank you. Okay, we now have a proclamation also for breastfeeding family-friendly community, and we have Love Anderson with us from the Breastfeeding Family-Friendly Communities of Durham, and so glad to have you with us tonight, Love. And I'm going to have Commissioner Carter has volunteered to, or she's agreed to read the proclamation for all of us, and then we would love to hear from Love. So, Commissioner Carter.
Yes, happy to read this proclamation. Proclamation, Breastfeeding Family-Friendly Community. Whereas families are a priority in Durham, and part of helping families to thrive is ensuring that they receive community support to develop and sustain healthy lifestyles. And whereas, according to the American Academy of Pediatrics, American Dietetic Association, American College of Obstetrics and Gynecology, American Academy of Family Physicians, and other leading health organizations, breastfeeding is the optimal food for infants. And whereas a mother's decision to breastfeed her baby should be supported by her family and community. And whereas breastfeeding is associated with lower rates of childhood illness, such as obesity, diabetes, and infectious diseases, as well as reduced risk of maternal breast and ovarian cancers, and a faster recovery from childbirth as compared to formula feeding. And whereas breastfeeding promotes maternal-infant bonding, benefits the entire family, and is associated with lifelong health and development. And whereas collaborating with healthcare providers and community resources can positively impact breastfeeding success. And whereas a breastfeeding friendly community encourages families of all races and ethnicities to continue breastfeeding by providing a supportive and welcoming environment. Now, therefore, I, Wendy Jacobs, Chair of the Durham Board of County Commissioners, and on behalf of the Durham Board of County Commissioners, do hereby proclaim Durham County as a breastfeeding family-friendly community this 13th day of April 2020.
Thank you, Commissioner Carter. And Love, are you still with us?
I'm here.
Oh,
Can you hear
great.
me? Oh,
Yes,
all right.
yes.
First-
Thank you so much for bringing this to us. And please share your thoughts and comments with us.
Well, first of all, we'd like to thank all of our community members who are out there on their front lines helping to support everyone in our community, including our health workers. Our goal at Breastfeeding Family-Friendly Communities of Durham is to support all families in our community during this unprecedented and stressful time. We know that information and recommendations are rapidly changing, and it can be difficult to find the resources you need to sustain your family, especially during this time where we are often separated from parents and grandparents and health professionals and all of our community support. We've put together a resource list on our webpage, breastfeedingcommunities.org, to support all families so that they can receive support via telehealth. And our focus at Breastfeeding Family-Friendly Communities, whether it's breastfeeding, chest feeding, human milk feeding, we want to support all families, including those that use formula, whether it's planned or unplanned. We are working to be sensitive to every family's trials, tribulations, pain, exhaustions, and needs during this difficult time. There's a great deal of work that still needs to be done in Durham, but we are so grateful for the progress that we've made. And our definition of breastfeeding success is defined by each family's individual needs and individual family desires. Thank you so much for bringing this to Durham County.
Well, thank you, and thank you for all the support that you and other people in the community are giving to mothers. And as you note, today, now it can be a very stressful time for families, and I can't even imagine if you're a new mother what that must feel like as well. So thank you for all that you are doing right now. And I just wanted to give other commissioners a chance to share any comments at this time. Well, thank you again for helping to raise awareness around this issue and to support people in our community now and always.
Thank you.
Thanks so much again, Love.
Thank you.
Okay, bye-bye. And we will have in the future a written copy of the proclamation that we will get to you. Or Monica, will you email that to her, I guess? Can you send that to her by email, I guess, at this time?
Yes, ma'am. I can send her an email with it.
Okay, great. Okay, well, thank you so much. Okay. My screen has just gone blank a minute. Okay. All right. Okay, now we have our consent agenda, and since we really never had we didn't have a work session, I thought it probably would make sense, Mr. Manager, if we kind of go through each item one by one and let staff really discuss the item briefly, because again, we really, this is kind of almost like a combination of a consent item and a work session and a regular session. So we probably need to just take each item one by one and maybe briefly discuss it and see if people have any questions. So I'll let you take over with that, Mr. Manager.
Thank you, Madam Chair. I hope that everyone can hear me. The first item on our agenda is item 129, which is essentially recognizing some state Department of Health and Human Services dollars at the tune of $195,954 for the purposes of us being able to do prevention and response for COVID-19. Our Public Health Director, Mr. Jenkins, is essentially the resource person on this, and I'd like to know if the board has any questions regarding this particular item.
This is Heidi.
Go ahead, Heidi.
Okay. My first question is, I noticed in one of the attachments that one of the requirements for this funding is that we develop and submit a COVID community intervention implementation plan. And I just wondered if, when that's completed, if we could receive a copy of it. I'd love to see in more detail what we're doing.
Commissioner Carter, this is Rod Jenkins. Can you hear me?
Yes. Hello, Rod. Thank you for all your work.
Absolutely. No problem. We'll be more than happy to get that to you.
Great. Thanks. And Rod, I was also wondering, reading the scope of work, so many different important activities that need to happen, but I was wondering if we here in Durham are planning to focus on any one in particular. Are there specific areas within those activities that the money can be spent for that we have a particular need for increased funding? So I was wondering what our thoughts are about that.
At first blush, I would say surveillance is key. Surveillance goes along with contact tracing and just ensuring that we're not leaving any stone unturned when it comes to tracking and ensuring that we are able to contact anyone. So at first blush, I would definitely say that would be the one that would jump out at first. Great.
Thanks. I'm kind of worried about that, actually, contact tracing and having the human capacity to track all the people down who've come in contact with those who have tested positive or who are likely to be positive. I know that's a nationwide problem, and I just hope we can do a really good job of it here. And that,
I would say that I'd like to give an incredible amount of accolades to our CD nurses. Even though our cases are rising, I will say that out of all of the health departments in the Triangle, we have never veered away from doing contact tracing. We do it in full. And the team that we've assembled, to include some registered sanitarians from our environmental health section, has done a wonderful job of contacting just about all of our contacts.
Well, fantastic, Rod. That sounds really good, and I'm glad that you're providing strong leadership for all of this, but that in particular, the surveillance component. So thank you for those answers.
Yes, ma'am.
This is Commissioner Howerton. Can you hear me?
Yes, ma'am, I can.
Thank you, Rod. And I, too, am so appreciative of all the work that you, your staff, and your whole team has been doing. It's been monumental work. And I just wanted to express that. And the other question that I have is around the demographics of, what we're hearing now, how this virus is attacking people of color. Do you have numbers on that? I know that where are we with that?
I do have numbers, and I do have that as a part of my report a little bit later. Happy to say it now, or I can wait until later if you so desire.
What's best for you? As far as the reporting those numbers?
So, Commissioner Howerton,
Yeah.
Howerton, this is Wendell. So, Rod is going to do a fairly comprehensive report at the conclusion, down near the end of the meeting. And so I would suggest
Okay.
that an opportunity to sort of weigh in on those issues then, if it's okay.
Okay, fine. Okay, thanks. All right, great. All right.
Okay, any other questions from any other commissioners? Okay, I think we're good on that one, Wendell.
Okay. So the second item, which is item 130, is essentially a execution of a pre-construction service contract with Chase for the parking deck at 300 East Main Street. Perry Mans is our resource person on this, and we are happy to entertain any questions that you have.
This is Commissioner Howard, and I have a couple of questions just for clarification. This was in our 17-18 FY 17-18 budget, capital improvement budget. Is that correct?
Yes, Commissioner, that is correct. This was a part of that total $56 million for the for both the 300 and 500 East Main Street deck.
And I also understand that it was not bidded out. There was no bid process.
That is correct, Commissioner. Perry Mans, Deputy Director for County Engineering. We are not at the point where we're actually ready to bid the project out. We will bid the project out probably in August of September. What this contract does, it allows us to bring on the CMAR, the construction manager at RIT, to actually help the design team with the value analysis, estimating, determining construction means and methods and materials, reviewing potential substitution, bidding, public outreach, and pre-qualification of subcontractors for increased minority participation. This is sort of a precursor to the actual guaranteed maximum price contract that we will be bringing back to you following the bid process.
Okay. All right. Thank you.
Yes, ma'am.
Are there other questions regarding this particular item?
I would just ask Perry, just with the, kind of changing landscape on things, will there be just extra efforts made to do things virtually related to this, working with folks? Whether you have to have a Zoom meeting to explain the project to possible, contractors, subcontractors, or whatever. Just curious about what your thoughts are about how to move forward.
Yes,
in
Commissioner,
today's
that's
world.
an excellent question, and we are already doing that from a design perspective, as well as the various meetings with the development team, as well as the actual CMAR. And so these folks are professionals. They're well equipped to use the same resources or similar resources that we have been doing to do video conferencing and virtual meetings. And so, yes, that is our approach moving forward in light of COVID-19.
Okay, thank you.
Any other questions regarding item 130? Hearing none, we will move to item 131, which is essentially a capital project amendment supporting the project that you just heard about, and it's essentially for the execution of some design services. And again, Perry is the resource person on this particular item. We can now take questions.
So I had a question, Perry. I know you in the previous item, you alluded to 22% MWBE participation. Could you remind us what our goal is, what our MWBE goal is for these types of projects? And I didn't see anything about that for this one.
Yes, Commissioner. Our goal is typically 25%, And I remind you that we will exceed that when we do our when we actually bid the construction project out. That's where we bring the subcontractors into the project, and that typically increases the participation significantly. This second contract is an amendment to Little's design contract, as they will be doing the design of the parking displacement that we're targeting up at 410 West Chapel Hill Street. And this is just a carryover to the previous contract that we've approved with Little. Both of these actual amendments are sort of joined together, in that the capital project amendment in the amount of the $500,000 covers both the CMAR pre-construction services as well as this amendment for Little. And so again, these projects are moving fast. There's also roughly 77,000 balance left over for us to get the site plan approval submissions and just geotech work, survey work, any other preliminary activity work that we're required to do at this point.
So is this amount to actually create the parking lot or just design it?
This is to actually design it, but again, this also includes some reimbursements for both the parking lot as well as like for the site plan submission on the 300 deck, some additional geotech work on the 300 site, survey work. It's combining the two, since Little is doing the design on both the displacement parking as well as the actual deck.
Okay. And just related to the citizen comment that we heard about handicapped accessibility, can you tell us about what will be the handicap features that are going to be incorporated into this deck? Because I know we are going to use the, technology that was referred to, at least some of it, to help people find parking spaces. So could you tell us more about that, how that would be specifically geared towards handicap parking?
Yes, Commissioner. Well, typically, what we've touted, during this whole process is the utilization of an app to help with the parking access and revenue control. And basically what that means is once a citizen comes to the deck or approaches the deck, they can use that app to find out what parking spaces are available, including ADA parking. And so we are truly flushing out, the amount of ADA parking on each specific level. And, we're, like I said, we're sort of wrapping up the schematic level design at this point. So I don't have the exact numbers as to what the total count will be for the ADA parking. But I do know there is a considerable amount based on what we've heard from the citizens that typically visit the Human Services facility as well as staff that parks there. And so that parking access and revenue control system is being implemented into the project. As far as some of the other citizens, the comments that were in that email, in terms of mobile sidewalks and automated storage and retrieval of cars. Again, our projects are fiscally driven, and we will have to take a hard look at, whether or not that is attainable in a project such as this. And so, but as far as easy access to ADA parking, we will be addressing that one. That's a no-brainer at this point.
Okay, thank you so much.
Yes, ma'am.
Sounds like we're all good on that, Wendell. Did we lose the county manager?
Okay, can you hear me now?
Oh, yeah, we can hear you.
All right, so
think-
I had actually muted myself accidentally. So you said
We
there
know
were
what
no
it feels.
because there were no questions on the conservation easement, item 137, correct?
And I don't think we got to it, but I don't know. We didn't get to that. I mean, we didn't actually officially get to it yet, but.
Okay, well, item 137 is essentially a conservation easement option with Mike and Tina Garrett at 514 Harris Mill Road. Jane Corrist is essentially our resource person and real estate manager, and we'll entertain any questions that board members may have. Okay. Hearing none.
I just want to say kudos to Jay and your staff again. Thank you.
You're welcome.
All right. We will now move to item 138. Is essentially Durham Public Schools seeking the board's approval to purchase 2 parcels of land near Elementary School C in Southern Durham. And I think Matthew Palmer is essentially on the line with us to ask any questions that we may have regarding that particular item.
Mr. Manager, can you hear me?
Yes.
I would like to just ask the school board person here, or the staff person, did they get appraisals for this property?
Matthew, are you on?
I am indeed, Mr. Davis. Thank you.
Okay, very good. Thank you.
Yes, and Commissioner, to your question at hand, both parcels are under contract for less than the appraised values. The county tax estimates. And so what we're looking at is doing the formal appraisal once we have a signed counter contract. But we've been waiting to ensure that the contract was an official contract before we invest additional resources during the due diligence period.
Okay. Well, that sounds good, and I really appreciate the context map that was sent. Obviously, those parcels are important for the project. So that was very helpful.
Are there other questions regarding this particular item? Item 138.
No, I just say ditto to what Commissioner Recca said. Obviously, they're key parcels.
Okay. Are we ready to transition to item 139? So item 139 is essentially a budget ordinance amendment appropriating $3.8 million in fund balance for COVID-related operating expenses. And Jody Miller will essentially take the lead on this particular item along with our emergency management director.
Good evening, Board of County Commissioners. Thank you for this opportunity to just briefly go over with you the information provided in this budget amendment. As you'll see by the attachment provided with this item, there have been quite a few unexpected expenses due to the COVID-19 response that the county started in mid-March. Everything from the hotel contract that you approved last week to shelter our homeless residents, as well as additional PPE, cleaning supplies, overall expenses that we've had to address that were not planned for or accounted for in the current year budget. And so what you see before you provides you what we know from this point moving forward to the end of the fiscal year of what we anticipate those costs being related to those items. And Jim Groves, are you on the call as well?
Yes, ma'am, I'm with you.
Would you like to add anything else to that?
And I'm sorry, I tried to turn my video on and it dropped me just for a moment. Could you refresh what the question is, please?
Would you have anything else you'd like to share regarding the budget amendment?
No, the budget amendment is really just to kind of help us cover our operational cost and the non-co-located congregate facilities. I think at some point in the future, we don't know where the end of this COVID-19 crisis will be, but we may be needing to come back to the board for additional requests should they come forward.
So we're happy to entertain any additional questions that members of the board may have.
This is Commissioner Howerton. I don't have so much of a question other than you could say more about, sometimes we get a lot of questions about fund balance and the usage of having it. And this is one of those times, it's thank God that we have it. So if you could say a little bit more about fund balance for anyone that's listening and want to get more understanding about what the fund balance is.
So, Commissioner Howerton, this is Wendell Davis, County Manager. Our fund balance is essentially our savings account or our rainy day fund. And unfortunately, with COVID-19, it is in fact raining. And so subsequently, this fund balance affords us the opportunity to be able to address these critical issues that we are confronted with as we are in the throes of this emergency. And subsequently, as you read in the agenda action form, it is our belief, hope, and desire that these will be, in fact, reimbursable expenses for this emergency as we move forward.
Thank you for that.
This is Commissioner Carter. Heidi, I have a question also, and it also is related to fund balance. I'm just wondering, with the concern that the pandemic crisis is going to be ongoing longer than we probably want it to be, and that there will be additional costs that we're going to need to cover. After we appropriate this $3.679 million from fund balance, I guess my question is, what will our unassigned fund balance ratio be at that time? Like how much more money will we have in fund balance that we can spend on emergency needs should we need to do that?
I don't know if Susan is on this call or not, but if you recall, essentially from our last audit, we were right at about 35%.
Wendell, this is Susan. I am on the call.
Okay,
and,
I'm sorry.
And as you know, our goal is to have total fund balance at 35% with unassigned at 16. As of the end of fiscal year last year, we were not at our goal for unassigned. We were at our goal for total fund balance. So we weren't at that goal for unassigned at that point in time either. And we've been trying to manage toward that goal. We were actually right in the process in fund balance when the system went down. So we're doing data validation now so we can pick back up and get everything posted up to date to be able to figure out where we think we might be. And there will be some county costs absorbed because FEMA, according to the documentation, is only going to reimburse up to 75%. So there is no guarantee and there is no 100%. So, and that's what they consider to be allowable and approved. So that's why that we've been trying to make sure that we document.
Right. Hopefully we'll get 75% reimbursement. That would be the ideal situation, right? If that's the most we can get. But so Susan.
And also there's some other funding sources that we've been welcome for, like the $194,000. That's an additional funding source. So FEMA, you have to absorb the other funding sources before FEMA will kick in anyway. So while that's another funding source, that comes off the filing before FEMA comes into play.
I'm just concerned that other priority needs are going to arise, and if we're already below our 16% unassigned fund balance ratio goal, how much money do we have left in our savings account that we can use to cover some of these needs. How much more would you all say we have to spend without being worried?
Right, and I think it goes back to, like, I believe Mo had in her justification, that she mentioned the fact that there was some, well, the libraries are closed, so, you know, that's cost that's not going out the door for daily operational. So once we're back up and we can get everything posted up to date, then we can see where we've got significant savings versus where we've had significant payments related to COVID.
Okay, well, that's really super important for us to know, as we have to make budget decisions going forward. I'm feeling a little, I'm just feeling anxious about the pending decisions that we're going to have to make about how to spend less revenue and we were hoping to be coming in greater need. Thank you, Susan and Dale. Thank you for the answers.
Absolutely.
Okay.
So Wendell, before we leave this item, I just want to follow up on the questions. I think that, from my understanding, if you can just clarify, this is what we expect to need through the end of the fiscal year, and we may not spend it all, but it gives you all the flexibility of having that money there when you need to make quick decisions and need it. Is that correct, Wendell?
Well, you got, there was an itemized list that Jerry provided with this attachment earlier, and those are the things that we have an awareness about at this juncture. Now, obviously going forward is going to be pretty uncertain. And to go back to something that Commissioner Carter, said about, where we are, this is very much so an uncertain environment, and we don't know what is in fact going to come up next. One of the things that we have to think through, essentially, is when the time comes for us to begin reopening our operation. We don't know what it means in the way of having tests available to test everyone who is going back. We don't know how the virus is effectively responding. We got to do a handsome amount of planning around that kind of work to make sure that we are in a sustained environment whereby people aren't getting sick again. All those things we have to think through. And so I know that's a long answer, but this will provide the funding that we need right now to address what we believe are critical needs, with a fair amount of uncertainty still out there.
Right. But I also just want to point out that it's important that we make this type of allocation so that we don't have to have, for instance, a special meeting when there needs to be some type of, that that you have some expenditure that people need to make. That we want to give you all that flexibility as well.
Just some flexibility, yes.
Yeah. And also, do you feel like, I think it would be good at our next meeting on April 27th, will you be able to provide us with at least some picture about some of the questions that Commissioner Carter raised, and just, I know that we're all thinking about in terms of the budget?
It may or may not be too early. I mean, I sent you a budget outlook last week.
Right, right.
What we believe we are seeing right now coming down the pipe. But as Susan indicated in her comments, one of the things that we need to do is essentially go through and evaluate where we are financially in light of the systems having been down. Obviously, that set us back in respect to our ability to do so. I don't know if in 2 weeks staff will have all of that work done, because, again, we're still sort of in crisis mode. Well, we are in crisis mode, not sort of. And, there's a lot of manual work still being done, particularly on behalf of finance. And so as such, if we can be ready, we will be, but I'd like the benefit of having further conversations with finance staff and some others in respect to making sure that I don't overcommit ourselves, particularly in light of the environment we're working in right now.
Okay. And my last question is, I guess, for Jody and Jim. If I understand that we could only potentially get 75% of reimbursement from FEMA, would any of this be possibly covered by the state?
Yes. I'm sorry, this is Jim. Traditionally, and again, this is a Stafford Act disaster, so there's a couple different options that the federal government will typically offer. So a 75%, and then the state may pick up the additional 25%. There's other times when the feds will reimburse 75%, and then state will go 12.5%, and then the local government will go 12.5%. And then in very, very, very unusual and dire financial situations, the feds have gone as high as 90%. But I believe, as Susan said, they've issued some guidance for 75% on this particular disaster.
Okay. And then aren't some of these funds also going to qualify for, if it ends up at the local level, for shared between the city and the county under our emergency management interlocal agreement?
We would have to work with the city yes, ma'am, to answer your question, our interlocal agreement with the city is they are responsible for the direct operational costs of emergency management. So many of these costs would apply there. We would need to work out the math on, does that happen before reimbursement or after reimbursement, or during some other negotiating process.
Okay, thank you.
Wendy, this
yes,
is Heidi.
Heidi.
Can I ask one more question, please?
Sure.
Okay, I'm looking at the budget, the chart, that one of our attachments, and there are all the categories listed, the dollar amounts and a description, and we have a description for all of the categories except for general government. I'm just wondering what the $305,000 is, going to be spent on.
It's for 200 and some thousand is for increased costs for janitorial services because of the continued need to keep scrubbing things down on a timely basis. And then 50 some thousand is for Nighthawk increased security services for the building and grounds as it relates to COVID.
Thank you. And I'm sorry, one more question. Do we feel like we have enough protective equipment for all of our people on the front lines and others who might need it? I know there's money in here for more of that. Do we think we're going to have adequate amounts at that time? Are supplies going to be adequate?
Ms. Carter, this is Jim Groves again. Right now, we're in pretty good shape, and we have placed orders to make sure that our frontline staff are well protected. We are trying to be as frugal as we can with the personal protective equipment to make sure it'll last as long as it can until the new shipments come in. I think the unknown right now is it's a very competitive market, and we're not sure when the new equipment or when the replacement equipment will be in, but we are in good shape for the time being.
Is it masks? Is it the face shields? Is it gowns that we need the most? What is the greatest shortage?
I think all the above. The mask are probably the most important to make sure we're protecting our respiratory tract since it covers the nose and mouth, and the eyes are secondary. Our goggles are good. We're in good shape there. So gowns and masks are probably the biggest need that we have right now.
Wow. Okay, thank you, Jim.
Yes, ma'am.
Madam Chair, if there are no other questions, I think that concludes our consent agenda.
Okay, great. So I would entertain a motion to approve all of the consent agenda items. That's 20-0131 through 20-0139.
Move approval.
Do I have a second?
Second.
Okay, moved by Commissioner moved by Commissioner Howerton, seconded by Commissioner Carter. All those in favor, please say aye. Aye.
Aye.
Any opposed? And the consent agenda is unanimously approved. Okay, so now we have a update on the COVID-19 crisis from...
Madam Chair,
Yes.
I wish to vote in opposition.
Oh, okay. Commissioner Hill, okay, has voted no. So that was a 4-1 vote. Okay, so then we have update on the COVID-19 crisis, and I guess I'll turn that over to you, Mr. Manager, or Rod Jenkins, Director of Public Health, whoever is going to lead on this. Maybe it's you, Rod.
Madam Chairman, our Public Health Director will lead this discussion.
Okay, great. Thank you.
Good evening again to the Board of County Commissioners, and Public Health would just like to say thank you to you all, to County Management, for all of the support. And we certainly thank Emergency Management for its partnership in this COVID-19 response. I've learned a lot about emergency management, and I believe that we've gelled together really well to create a fantastic response thus far in the face of some serious circumstances. Public Health supports the unified stay-at-home order by both the county and the city of Durham as an effective and evidence-based mitigation strategy in order to prevent the spread of COVID-19. So I thought it's not robbery to commend the board for moving ahead with that. And I also like to commend the board for your decision to have that emergency meeting in order to allocate those funds for lodging our homeless population, because once again, that's an evidence-based mitigation strategy to prevent the spread. As of 6:30 p.m. this evening, current case count going from global to local. Per the World Health Organization, we are at 1,776,867 cases of COVID-19, resulting in 111,828 deaths. That represents 213 countries, areas, or territories. Within the United States, there are 554,849 cases of COVID-19, resulting in 21,942 deaths. That is in all 50 states and 5 territories of the United States. And within the North Carolina, there are 4,816 cases of COVID-19, resulting in 86 deaths. And that's in 92 counties within North Carolina. Within Durham County, we have 325 cases of COVID, resulting in 1 death. And we still have quite a few that are still under investigation. In terms of percentages, 20% of our cases are community spread. That's rather low. 76% of our cases are travel-related or close contact of a confirmed case. And I'd like to point out to the commissioners that that is what we are seeing most frequently as in the past couple of weeks. Of course, we have 3% that are still under investigation. So the 20% again is a direct correlation with our mitigation strategy of staying at home. 67% of our cases have been discharged based upon the guidance of the North Carolina Department of Health and Human Services. In other words, they are no longer under isolation by public health. So we'd like to say that they are in recovery. 85% of our cases are under the age of 65, with 15% being over the age of 65. That's the highest at-risk category that we have here in Durham County, and I'm glad that number is low. 51% of our cases are female, 48% of our cases are male, and there are 1% that we do not have gender data for. We do have outbreaks at 3 long-term care facilities as reported by the media outlets on today, and we are vigorously working with those facilities as well as all other facilities in Durham County. Last Friday, we did conduct a webinar that was well attended by the long-term care facilities in Durham. We had great participation. That webinar was recorded for later use and later reference. So we continue to make progress on that front. Within the Emergency Operations Center, we have formed our long-term care facility and congregate living task force, whose aim is to bring greater awareness and to visit on site, if need be, whenever there is an outbreak. We're also proud to report that we are looking to receive support from Duke Medical Center from their population health and physician assistant program to further enhance our contact tracing efforts, and that should be underway within the next week or so. We continue to enhance our screening at the Health and Human Services building for our Emergency Operations Center staff and our Health and Human Services employees and clients. At the direction of our General Manager, Joanne Pierce, we being ourselves in DSS, have successfully reduced our hours of operation in an effort to protect not only our citizens, but our most valuable assets, which is our human resources, in an effort to make sure that they're not in harm's way and reduce their exposure to people entering the building. In terms of public information updates, we have issued press releases about long-term care facilities and COVID-19 outbreaks, as evidenced by the press releases sent out today. We finished receiving our stay-at-home video submission for the first video. Special thank you to our chair who submitted her video on Friday, and that's to be shared and published on tomorrow. We created and shared new graphics for mask guidance, wearing masks, I should say, and for the state executive order that went into effect at 5 p.m. on today, and that's the newest executive order. We issued press releases about long-term care facilities and the COVID-19 outbreak, just in general, and what I've been doing for the past 5 weeks is filming a weekly health director update to further explain and to have a personal connection with our general public as it relates to questions that we've received on social media regarding COVID-19. At this time, I will turn it over to Emergency Management.
Good evening, Chair Jacobs, Commissioners, and Managers. This is Leslie O'Connor, your Chief Emergency Manager for the City and County and Incident Commander for the Durham County COVID-19 response. Today marks the end of day 27 of our 7-day per week operations of the Emergency Operations Center activation related to COVID-19. Public Health has been working in partnership with Emergency Management on COVID-19 since February, and our systems officially joined forces under the Incident Command System structure on March the 19th and established a new Emergency Operations Center in the Human Services Building public meeting spaces as a way to meet the demands of social distancing and keeping our teams as healthy as possible. We are so proud of the partnership that we've created with Public Health, and without that partnership, this truly would not be a joint effort. Our Emergency Operations Center is comprised of approximately 60 individuals from the county, city, National Guard, and nonprofit partners working both in the EOC and virtually. We've divided our operations section into 3 branches, including Public Health, Public Safety, and Human Services. You heard from our Public Health Director on our Public Health update, so I'll move on to our Public Safety branch. This branch is comprised of representatives from EMS, County and City Fire Departments, the Durham County Sheriff's Office, City PD, and Durham Emergency Communications Center. The Public Safety branch works together to ensure a safe response to the community that also keeps our responders safe. Our Human Services branch is subdivided into 3 task forces, including DSS, homelessness, and food security. DSS has worked tirelessly to move many of their services to virtual as much as possible. Additionally, as of April the 10th, they had $1.7 million in supplemental SNAP benefits issued to Durham County residents due to the COVID-19 pandemic, which provides additional food resources to over 10,000 households and over 21,000 individuals. They're also sharing guidance with adult care homes in order to protect these locations from potential COVID spread. Our homelessness task force has successfully moved all residents of Urban Ministries of Durham to the Marriott RTP Hotel, which happened this last Friday, with the assistance of Go Triangle, County General Services, and City General Services. Since this move, Coordinated Entry has received 80-plus calls and are responding to this volume of calls as quickly as possible for other individuals interested in entering into the system. We're also working to secure rooms at a second hotel for 2-week quarantines of individuals released from prison and detention systems, as well as individuals who have tested positive for COVID and don't have a place to go. The Food Security Task Force is working with the Durham Public Schools Foundation to assume the student feeding efforts. The new feeding plan will work with nonprofits, restaurants, and caterers to supply both warm and shelf-stable food with a mix of privately raised, corporate, and county funds. This task force has also developed a public health approved way for farmers markets to continue operation, helping Durham farmers to stay in business and help continue the flow of nutritious food to those who need it. Our logistics section is feverishly working to order and receive personal protective equipment, or PPE, both on the market and through North Carolina Emergency Management. We are beginning to receive partial shipments of that PPE and distribute it upon receipt. Our planning section is documenting our incident and creating future plans that can be operationalized as they are needed. Lastly, our finance section is working to execute contracts and procure goods and services throughout the COVID response. Additionally, they have completed application for public assistance under the Robert C. Stafford Act for federal reimbursement of emergency protective measures, many of those that have already been mentioned this evening. We are thankful to the Board of Commissioners for their support throughout the response to this pandemic. Many working on the front lines have experienced the loss of loved ones due to this indiscriminate virus, and we are working tirelessly to flatten the curve and to stop that loss. That concludes the emergency management report out, and I turn it back over to Manager Davis.
Thank you, Leslie. I just wanted to take a second to see if Jody or Jim had anything in addition that they'd like to add before we open it up to questions.
Mr. Manager, this is Jim. If I could, really want to recognize the staff in the Emergency Operations Center. Leslie and her group has done an amazing job. Public Health, Rod and his team have been truly amazing to work with, and it's been really, really collaborative. Ben Rose and his team with the SNAP, I think they're going between 200 and 300 SNAP applications every day. A tremendous lift. You know, from the Fire Marshal's office, staffing logistics, to the EMS captains filling in the planning section. Our medic units are responding nonstop. In some cases, we're seeing an 800% rise in certain facility transport. And our staff are doing this without complaint. They're showing up, and they're doing just an incredibly amazing job. So just wanted to point that out to the board. You have an amazing team there working for our community. I'm just so proud of them.
Jim,
This is Jody Miller. I would echo Jim's comments, and I don't have any additional details to add.
Thanks, Jody. Joanne, did you have anything you'd like to add?
Yes, this is Joanne Pierce, General Manager for Goal 2 Community Health and Wellbeing. I just want to echo every single word that Jim said about this amazing staff that we have in Durham County government, working tirelessly to do the work that they're doing. And the behind-the-scenes work is just extraordinary. Thank you.
Commissioners, one thing I did want to sort of weigh in and say, and you heard Jim mention it earlier, as well as Leslie, I believe, in their comments, they talked about essentially the need for a second quarters or a hotel. And so when we talk about, you know, a lot of the uncertainty that's associated with how we move forward, obviously, those are the kinds of issues that sort of avail and emanate themselves oftentimes on a daily basis in respect to what the planning units are confronted with in the EOC. And so I just wanted to make sure that, you know, in light of these challenges that we're facing, although they mentioned it, that, you know, it's not overlooked in respect to a potential future need. So at this point, I don't have any additional comments. I'd like to open it up for any questions that the board members may have.
Mr. Manager, can you hear me?
I can.
Okay. I want to thank all the staff. Those were excellent reports. I did want to follow up with the public health director. My question is, there was an article in today's paper about a woman, an employee who attempted to wear a mask at a local nursing facility and was actually disciplined for it and sent home and I guess fired. And that was after the county put out a directive asking for masks. What bothers me is those directives don't appear to have been implemented, at least at that facility. I don't know if others did. But we have such a fragile population in these facilities, and I just wonder what the status is, and are people going the extra mile to try to protect such fragile and vulnerable residents in these facilities?
Thank you so much for your question, Commissioner Reckow. And I'll follow up by saying that we did not only make the call, we also dispatched our environmental health director, Mr. Chris Salter, to that facility. And we did follow up, and without going into too much detail and without naming names, I will say that a lot of the information that was published was found not to be accurate. And I'd be more than happy to share with the board, our findings from that particular situation. And I think once you read what was published and the feedback that we got from our environmental health director, you will understand everything that I'm talking about.
I see. Okay, I guess we can't always trust what you read. But the follow-up is, in general, are you satisfied that most of our facilities are taking appropriate precautions?
Commissioner Reckow, I will say that prior to COVID, our COVID numbers increasing, we did dispatch our environmental health specialists to all of those facilities. We did provide literature. We did provide on-site education about COVID. And most recently, we did require them, or humbly requested them, to put themselves in harm's way and to revisit these facilities. And that was met with a thumbs up. They said, you know, we've talked to the same individuals, they get it, they understand. So to definitively answer your question, ma'am, the answer is yes. I do feel as if, by and large, the majority of the businesses who deal with this fragile population do want to do what's right. They do listen to the directions they receive. And, you know, we're ever so careful not to let one particular situation represent the whole. I hope that answers your question.
It does, and I appreciate that you had the staff actually, and there's nothing like actually going out and seeing what's going on. So I appreciate the staff doing that, putting themselves in harm's way. But on the other hand, we have thousands of people in Durham in these facilities. So it's very important that they're being treated well, and so I appreciate the work that you did to investigate that.
Yes, ma'am. And also, Commissioner Reckow, as a follow-up, we did, we devised a plan last Monday to create the webinar for these different facilities, and we wanted to record it just so they'll have a reference. That webinar was attended by myself, our medical director, again, Mr. Chris Salter, our environmental health director, and our CD nurse, Ms. Kathy Hines. And we wanted to create this open forum, but more importantly, we wanted to create this avenue for them to go back to. And as mentioned, it was well attended, and I was pleased at what we produced in such a short period of time.
Good. Thank you.
Yes, ma'am.
Are there other questions regarding this particular update?
Hi, this is Heidi. I have a couple. First of all, I'd like to say the reports make me so happy. They're great to hear. It's great to hear these details. And I was wondering if we could get copies of the reports, if that would be something that would not be burdensome to ask for. The reports that you
This is Leslie with Emergency Management.
I don't think that will be a problem. We can forward those reports.
Oh, that'd be awesome. Thank you for that. They were just filled with good details. Thank you. That'd be great. Let's see. Probably most of my questions, I don't know if they're mostly for public health. This is kind of a general question, but I'm just very interested in the testing protocol. And I'm wondering if Durham has its own testing protocol, or does North Carolina have a testing protocol that all counties consistently use? Or does it vary between public and, private medical facilities? I just am real curious about that. I think it's an important data point, the rate of testing. Just curious.
Commissioner Carter, this is Rod Jenkins, Public Health Director. It varies, and as you well know, and has been highly publicized, it mainly varies based upon the ability to get the test kits. And I'm pretty sure Leslie will attest that it seems to be that if you're in a crisis and you go through WebEOC, through emergency management, you're able to get your hands on tests at a much more quicker rate than just the state being able to just on their own give us a plethora of tests on their own. So that's one point. The protocol has been established by the North Carolina State Lab as far as testing. So all counties follow that protocol. However, there's three major players as far as labs are concerned, and it's quickly expanding every single day. Every call that I'm on, Commissioner Carter and other commissioners are telling us to be leery of these fly-by-night commercial labs that are, really trying to get a quick buck. Things like, reporting and how they, protocols for their assays are things that we have to look for. I'm very fortunate to have a very thorough lab manager who understands the intricacies of that. So those are the things that we are up against, but I will say that the state has been very accommodating with our most recent situations with 3 long-term care facilities, and we certainly have a lot of test kits on the way.
Thank you. What a challenge. And the one reason I ask about it is I know that we've reported in Durham that we have a lower rate of infection than other parts of the state, and that our rate of infection is decreasing, and it's due to our social distancing measures. But I just wonder if we can actually even say that if we don't know what the testing rate is from community to community. It seems like that would really be important, that we all are testing in the same way and at the same rate in order to compare our infection rates. am I thinking correctly on that?
I think you're spot on, Commissioner Carter. Testing is definitely being hampered by the lack of test kits, and nevertheless, you can only go by what you have available and the data that you have at your fingertips. And as it stands right now, Durham is doing extremely well in terms of the rate of community spread, which is right at about 20% by our calculations and the folks that we've been talking to with Duke University. The rate of increase of, I guess, us going up the curve, as you would say, last reported was right at about 7%. So, we have definitely something to be elated about, but again, the fight goes on. And as I said to my my staff, again, it's one team, one fight. We're all in this together, so the only thing we can do is just continue to take things one day at a time.
Right. Thank you for that. Do we have any additional information on the jail and how we're doing in protecting those who are incarcerated and those who work there, and what our numbers are? I have people ask me about the jail a lot, and of course we're not over that, directly. So just wondering if anyone has any more information on that.
Yes, ma'am. While I don't have numbers, I can only go by what the sheriff himself said on the last multi-agency coordination call. We call it our MAC calls. And he did attend the last one, and he did indicate that there are no positive cases of COVID at the jail, and they're taking every precaution to screen properly, temperature checks. They're isolating individuals, well, not COVID positive, but making sure that they stay inside their cells. Every precaution that we could ask. And he is saying that he is following the CDC guidelines for correctional facilities. And I know personally, I've sent him those instructions myself. So I guess it's safe to say, I don't want to speak for him, Commissioner Carter and others, but he said that they're doing well and holding their own in the jail.
All right. Well, that is good to hear. And I guess this last question of mine is more just a sort of county government operations question. I'm just curious about the number of employees or percentage of employees, or just an estimate, not an exact number, but that are able to work from home and that are able to do the majority of their, work responsibilities from home. And, have we had to change any of our HR policies because of COVID?
We've changed, we have drafted a set of new emergency policies as a result of COVID. We started out probably 3 weeks ago capturing those statistics in respect to how many folk were at home. Of course, since that time, we have thinned out the organization even more. When it gets down to a hard number in terms of the number of people who can work at home, I can't tell you what that number is right now at the top of my head, because we have sent additional folks home, particularly in light of understanding that over the next couple of weeks we were anticipated to get a spike. But we can gather that data and have it available in the future.
Well, that would be good. I mean, I'm really just thinking, is it ballpark? Is it 50%? Is it 75%? Is it 90%? Is it, what would you estimate?
Are you talking about the number of people who are not coming to the office right now?
Right.
Yeah, I would probably say it's close to about 90%, maybe a little bit more.
Wow. And some percentage of those are able to do their work, but not everyone.
All right. But, there are needs, and so subsequently, you have some employees who may work at the library, but they will come to the Human Services Complex and do temperature checks, or check people into the building. There might be employees that work within specific programs in the health department that might be needed at the EOC or in some other functional area where we may need a helping hand, and so those options are open for employees.
That sounds good.
They're working out of, they're not doing their traditional roles.
They're being redeployed, so to speak. Thank you.
So I just want to follow up on my question. Given what we're hearing across the country about people, black and brown people are the ones that are being affected mostly. Are you, I don't know, I don't remember if you said you could answer that tonight, or is that something you want to answer later?
It would definitely be something that I would like to answer later, Commissioner Howerton. And reason being is that at the onset of Durham's numbers spiking, our numbers were skewed because we had a heavy influx of student travelers from Duke University, and that kind of threw the numbers off a little bit. Additionally, we knew that the state was not collecting that data, and most recently they started. So I will just say that's something that we have begun to collect. Additionally, I would also say that as indicated on the state's website, there's an enormous amount of data that is just unknown. They don't know the race, they don't know the age or gender. So those are all the things that we would have to work through, but we will definitely get that information to you.
Okay, great, thank you. All right.
Okay, are there any other questions regarding this particular update on COVID?
Well, I don't know if I'll wait and see if Commissioner Hill has anything before I ask some follow-up questions. I don't know, Commissioner Hill, I didn't want to cut you off.
I'm fine, thank you. Sorry.
Okay. Well, I just want to also echo what everyone else has said, which is that the amazing report that we got and the amazing work that is happening every single day with Durham County government, and also in collaboration with Durham City government, Durham Public Schools, Duke University, just incredible collaboration. So I really appreciate everyone. I really appreciate our board for acting so quickly last week. I mean, literally I guess it was like the day before or the day of that the day before we found out that we had the authorization from FEMA, and also the state government had come through to fund housing for homelessness. And I'm so proud of our board for acting so quickly, and for our staff all the homeless team that was ready to go Friday morning, literally the next morning, that successfully moved everybody. It was just incredible. So thank you for everyone who was involved with that. I want to follow up on a few things that were raised. Commissioner Howerton, your question about the racial disparities, I actually raised this last week on one of the MAC calls. I think it was Commissioner Recco had asked for the racial data, and I did put in that request, and also just had raised the issue of some of the racial disparities, and people have said it's linked to poverty, it's linked to just some of the other social determinants of health, and possibly underlying the prevalence of underlying health issues in the black community, like hypertension, diabetes. But be what it may, I do want to echo that, and that I hope there'll be an effort to partner with community groups like the Community Health Coalition, the Durham Committees on the affairs of Black peoples, their health and safety committee, and really the interministerial alliance, and just ways to really do a lot of outreach into the Black community, education, not about COVID and about the things that people can do to protect themselves, but also things that people can do to improve their health. So I guess, Rod, has there been any discussion within your team or within health you've got tons of great community health educators. Has there been any discussion about just any of that kind of targeted outreach?
Absolutely. I received an invitation from the Durham County Affairs of Black People to be a part of a Zoom conference on this very topic for next Tuesday. I believe it's the 21st. I've not been a little busy in the EOC, but not had an opportunity to accept that. But I just wanted to point that out to you. Additionally, in collaborating with Leslie and my general manager, Joanne Pierce, we did talk about the Racial Equity Institute and racial equity aspect of our COVID-19 response. And I'll just go ahead and punt it over to Joanne just to elaborate on some of the plans that we have coming up.
Thank you. I'm here. I'm sorry about that. I was muted. Yes, this is Joanne Pierce, General Manager for Goal 2 Community Health and Wellbeing. Good evening to the Board of County Commissioners and to the County Manager. Yes, there have been conversations with partners around racial inequities and disproportionality regarding African Americans and COVID cases. And there are a few takeaways and potential next steps. Certainly, this is a crucial discussion to have, and when we are in a crisis of this magnitude, disproportionalities and inequities by race and ethnicity are more pronounced and compounded. Emergency planning that does not factor in health inequities can often create cascading sets of additional problems to solve. And while we know that anyone can contract the virus, we also know that the impacts on communities of color are proven to be more severe. People of color are disproportionately likely to be in low-paying or hourly wage jobs that make them unable to provide care or interrupt work. They're also more likely to have limited access to affordable health care, child care, and transportation. We've also discussed regarding the racial and ethnic disparities in health care and ways to address them. It is critically important that we have shared language and understanding of the problem we aim to solve. Decisions and solutions without an embedded race analysis, albeit well-intentioned, often produce negative consequences by race. And then just to share a couple of operational definitions, racial disparities are simply differences in the presence of disease, health outcomes, or access to health care between population groups. And racial inequities, on the other hand, are differences in outcomes that are not only unnecessary and avoidable, but in addition are unfair and unjust. So if our focus is to address unnecessary, avoidable, unfair, and unjust racial inequities, then the problem to solve is for racism. And it is possible. And because we are only as safe and healthy as those members of our community who are most at risk as a result of structural and systemic racism. And there was a question about what can be done now and ongoing. For this event, we must have, as we do, an approach that provides accurate information and advances practices and policies based in science, and that ensures compassionate and comprehensive essential services for those most vulnerable to exposure. It is also important that we embed racial equity principles as a strategy to mitigate in meaningful ways. And then what's required, tangible commitment to racial equity, willingness for us to unlearn and learn, and courage to make actionable steps to create a more just Durham. To be effective, racial equity work must occur across sectors and especially at the highest levels of our local government. And I'm reminded of Neely Fuller's quote, "If you do not understand race, what it is, and how it works, then everything you do will only confuse you." Thank you.
Wow. Wow.
Wow. Well, thank you, Joanne.
Wow.
If you just know all that off the top of your head, I'm completely blown away because you were just kind of, you know, I don't know if you were already prepared, but thank you so much for everything that you just shared with us. So it sounds like you all are working on this issue, which is great to hear. If you all can just posted on this and how we might be able to support anything that you're doing around this in the community. And I guess also related to just other vulnerable communities, thinking of our refugee community, immigrants, and our Latinx community. Could you tell us a little bit about what types of efforts are happening in those other also vulnerable communities?
Sure. This is Joanne Pierce again. In general, when we focus on those who are least likely to achieve positive outcomes, we improve opportunities and access and outcomes for everyone, regardless of race or ethnicity. And that includes everyone.
So, Madam Chair, I just want to, and Joanne, I too want to weigh in on, I'm just really, really appreciate the conversation that you just had. Because I think it's so important that we address these issues. And the other thing that was present to me as you were speaking, and it's present across this country right now, that when this is over, the most vulnerable people will be Black and brown people, that we're talking about their health, but their health you can't improve their health if they don't have decent food and if they don't have any money. You have no money, you can't buy. It's expensive to eat well. It costs. So as we're looking at this ending, how will people be able to take care of themselves and even eat with any type of healthy food? And I know that Durham works hard to get healthy foods into homes, but it's going to magnify itself.
This is Joanne again. Thank you, Commissioner Howerton. And those are definitely the conversations that we're having. Currently, what's happening now, and also how will we mitigate embedding an analysis in a race equity lens right now, looking forward to what next, what will be the impact of what has already occurred. So thank you for that.
Thank you.
So my other question was, Rod, I know Commissioner Recca was asking you about the long-term care facilities, and I know it's certainly concerning to see that we've got 3. I know last week you already were ahead of the game and started a strike force, and that you're doing outreach. And now the governor has implemented today some stricter guidelines around the adult facilities and also stores, which I'm really glad about. I don't know if you had any thoughts of any other things that we could be doing, or that you needed more, if you felt like you have enough staff to do it, and also just related to congregate living in general. I know our special meeting, we talked about just having protocols for any type of group living situation. And Leslie, you talked about how the EOC was going to try to pull something together for the hotel, just related to, best practices, temperature checks, and I mean, really even face coverings, all the different things that really we should be looking at. I mean, I'm worried about places like, the rescue mission. I'm worried about TROSA. I'm worried about all the places that people are living in group situations. Of course, our seniors are our highest risk, but they're still, we're talking about racial disparities, or racial inequities, so that still is also an at-risk population and other places. So I guess wanted to hear from Leslie or Rod what your thoughts are about any other things that we could be doing for kind of congregant situations.
I think I'll go ahead and get started. The main purpose of this long-term care facility, congregate living strike force within the EOC is to just be very aggressive in these sectors and just try their best to really think about all of those different things which you just mentioned, places that you just mentioned, just to make sure that we leave no stone unturned. As Leslie indicated, this is day number 27, and I can't say that there's been a day that I've been in the EOC that we've not thought or pondered or tried to come up with what else we could do to try to thwart COVID-19 spreading rapid inside congregate settings. When it comes to those areas that you just indicated, like the TROSAs and the rescue missions, I will say that they have their set of policies, their continuity of operations plans, and they're very thorough. But you just can't predict what might happen, because there's some long-term care facilities that we have talked to in the past, talked to recently, that literally had great plans of action, but things like workers who may work at a certain facility and moonlight at another. Those are the ways that COVID enters those well-kept facilities, and those are the kind of things that you just simply cannot account for. So we just, again, Madam Chair and others, we just do the very best that we can. We continue to synergize and bounce ideas off of each other. We have this EOC structure to make sure that we don't leave anything to chance. And we've done the very best we can collectively as a unit to try our best to not leave anything to chance. So I can't really think of anything else that we may not have thought about. Leslie, you're welcome to chime in.
Sure, thanks, Rod. Specifically with regards to doing any types of screening, temperature screening, with urban ministries, and now having them moved over to the hotel. Before everyone was moved, they did have a temperature screening done at breakfast, and they went to the hotel with their screening paperwork showing that they were not symptomatic. The urban ministry staff has also implemented daily temperature checks on all the individuals that are staying at the hotel. Our homeless task force has been in touch with both families moving forward and also the rescue missions in an attempt to kind of work through these situations and work through those best practices to try and keep COVID from spreading. But I think that Rod really brings up a very, very important point that, unless these facilities, which is very likely to happen, but unless these facilities were to go into lockdown and not allow anyone to come in and out, COVID can be introduced in that manner. And it certainly is not an intentional introduction, but it's just an introduction within the system. And many folks do moonlight, and they do have multiple jobs in an effort to be able to make those ends meet. So really at this point, it's piggybacking on the stay-at-home orders that have been put in place and really providing the education to these locations, and we are working through the task forces and also through the future planning cell that is within our planning section to try and highlight, okay, what next? There certainly is not a day that goes by that we don't all look at each other and say, what is next that we can potentially plan for, so that if and when the time comes that we have to operationalize that, the plan is already in place. We just have to put the parts together to be able to make it happen.
Well, thank you, Leslie and Rod, and I think you both said it really well, that we've all been trying to figure this out day by day, and everybody is just thinking about this all the time, and I think it's thanks to everyone's collaboration and everyone's hard work that we're even have made this much progress, and to the people of Durham. I mean, because at the end of the day, it's about individual responsibility, and this community has really stepped up, and people are I mean, for the most part, people are taking this very seriously, not just for themselves, but because they know it impacts everyone else. So we're all in this together, as you said, Rod. So thank you all.
So, Madam Chairman, if there are no more questions regarding this particular update, I'm perfectly ready to transition to our malware update. Hello?
That sounds good. Yep. Thank you.
Okay. Well, as Greg comes forward to just kind of update us on where we are in respect to recovery on the malware attack, I would just want to say that I commend our staff across the board. It's been, in many respects, almost a nightmare. I've managed through a number of different crisis situations during my 30-year career in local government, but never have I had the luxury of managing war rooms at the same time, and of course have something like COVID impact my own personal life, as I've lost 3 family members as a result. And so I want to commend Rod and Joanne and Leslie and Jody and Jim, everybody that's actually been sort of a part of this, but just as hard as they are working in our formalized EOC since March 6th, the same thing has been going on in our war room on the top floor, 200 East Main Street, and it has been a war room because these folks, just like the EOC, have been working around the clock, nonstop, to get our system back to where we need to have it in order to be functional. And so I want to commend Greg and his staff as well before we get started. Greg?
Yes, sir. Thank you, County Manager, and good evening, Board of County Commissioners. So what I want to do this evening is give you an update on where we are with our malware attack. We can go to the next slide. So just a little bit of background, and I'm sure we all are aware, as the County Manager mentioned, on March 6, the evening of March 6, 38 days ago, Durham County government experienced a ransomware attack. And as I mentioned in my last update, ransomware is a form of malware or malicious software that encrypts a victim's file. And as I stated before, this malware attack is very similar to what happened back in 2019 in New Orleans, where they actually declared a state of emergency. That's how serious it was. And the type of malware is called Ryuk. It's been around now since the beginning of 2019, and it has affected several municipalities. And as we know, this one affected both the county and the city of Durham. If we go to the next chart, I put this together just to give you all a sampling of state and local government ransomware stories from 2019. This is just a continuation of what's going on. As you can see, Louisiana government had to declare a state of emergency. New Orleans declared a state of emergency. Last year, 22 Texas towns were hit with ransomware. Hackers, hit Baltimore, and I think we all know, how serious the Baltimore attack was. And believe it or not, they are still in restoration phase. Several municipalities in Florida was hit with ransomware, and several of them also paid the hackers. Mississippi was disrupted by ransomware, and we know not too long ago, our fellow county, not too far away from us, Orange County, was also hit with a ransomware attack. So this is not something that's unique to Durham County. Everything that I'm reading now says ransomware attacks are on the increase as a result of this COVID-19. Particularly, hospitals are being hit hard with ransomware attacks. And what the bad actors are also doing at this point in time is taking advantage of everyone who's working from home and maybe using insecure connections back to their networks. If we can go to the next chart. So this gives us a little bit of an update on where we are today. As I said before, this has been an all hands on deck, around the clock, 24/7 exercise for IS&T over the last 30 days. And I really want to thank the team, the IT team, for their dedication and commitment to work around the clock to restore county systems. I've been very proud of the amount of work that we have been able to accomplish. I'm very proud of the team and what they've been able to do over the last 38 days. Many of these projects that we have accomplished, this would have taken 6 to 8 months to complete, and we've essentially have had to rebuild our entire infrastructure. So a big thank you to the team. I want to thank our partners, particularly emergency management. They were there on day one, helping us, and so a big thank you to Leslie for her support throughout this process. And I also want to thank the county manager and the Durham County leadership team, the general managers, the department heads, for their support throughout this fiasco and for their patience, most importantly, in working with us in restoring these systems. As I speak today, I can say that most of our critical public-facing systems have been restored. That includes with the Register of Deeds, tax, public health, DSS, budget, and human resources. Restoration of those public-facing systems, that has been our highest priority. And we're in a very good place today than we were 38 days ago. In addition, most of our communication systems have been restored. That includes our phones, our voicemail, our email systems, our employee portal. All of those systems are now up and running today. We've completed the restoration, the cleaning of over 2,000 plus county laptops and desktops. Many of those systems, software are being restored on those systems as we speak. Most of those systems, they're pushing out software, so one of the challenges as a result of COVID-19, many of those systems are not connected to our network, and so to get those updates, we're having to work around the clock to make sure employees receive those updates. In addition, nearly 300 servers, 800 databases, and over 2 million documents have been scanned to ensure systems, servers, and data, the data on those systems are clean. Most of our business systems we've turned over now to the business departments, and those departments are actually doing their work. They're validating the data before we open those systems up to the rest of the county population. And as I said before, we've completely rebuilt our infrastructure environment, adding new security enhancements to minimize the severity of possible future attacks. And what this means is that we have, if you think about it as a rope with a knot in it, and bringing these systems back online, we have really tightened the knot as tight as it can get. And what we do from there is, depending on how it works out, we will loosen that knot a little as we run into challenges. But I can tell you, we've taken some steps to really tighten up on our environment from a security standpoint. We go to the next chart, the last chart. So again, restoration work is still continuing. As I said before, we approach it from a core systems, working on our core systems first, and then we, the next approach would be to look at our enterprise systems. And once we get our enterprise systems restored, then we start to look at those individual domain-specific, department-specific applications. So we're still in the restoration phase of getting out of this challenge that we're in. In addition, we're focusing on some COVID-19 system changes that are required. And lastly, we're providing tools to help employees and departments work remotely, efficiently and effectively. So I say that just to say we're not just doing restoration work. The other work within the county has to go on as well. And so we're certainly beginning to lift our heads up now and focus on some of that other work that has to take place. So that concludes the IS&T report out, and open to taking any questions that anyone may have.
Madam Chairman, the floor is open for questions.
Commissioner Howard, did you have a question? I think we're having trouble.
What was that? What you said?
I didn't know if you wanted to ask Greg a question.
No, I'm good. Thank you, Greg, for all your work and your staff. This has been, I said, called double whammy. 2 viruses at one time. That's what's called double.
It certainly is a first for me.
I saw you one day and you looked so exhausted. So my heart goes out to you and your staff. I came up and started, I took my computer up there, and everybody's been working so hard. I tell you, we're blessed to have all of you.
Thank you.
Okay, anyone else have any questions, comments?
No question, just a comment. Same thing. Greg, thank you for all the work that you and your staff have put into this. I know you've done yeoman's work, and I want to let you know that I appreciate it, and thank you for all you've done to get the enterprise back in order. Thank you.
Thank you, Commissioner Hill. Thank you.
Well, I just want to echo everyone. Your description of everything that people have been doing is really mind-blowing. So thank you to everybody who's been working so hard. And Greg, I know that we'll have a better system than that. The silver lining is that it will be better than we were before, right? Yeah. When do you expect to, would you say, I know you said, something like this could take 6 to 8 months really to really fully recover. Do you have any expectation of like when you'll feel comfortable saying, I feel like we're really, I can say we're fully recovered? Do you have any idea of what kind of time frame that would be?
So I think in terms of what we call our P0, which is the basically infrastructure related kinds of things, we're about 90% complete with that. And so we'll certainly be done with that within the next 30 days. Our P1 are those applications that directly impact citizens, and we believe we're probably in the 70% range in terms of restoring those. And so I think over the next 30 days, we'll be done with that. Some of that has a dependency on the city as well, because we do share in some of these applications. And then our P2 is our enterprise applications, things that I talked about this evening, like email, voicemail, those kinds of services that affect all employees. We're probably pushing around 90% complete there. And then I think the last area is our P3, which are those department-specific, unique types of applications. That's probably going to take a little bit longer than everything else, and that'll be our last kind of focus area. So I would say over the next 60 days, we should be done with this, if not sooner.
Well, thank you, and I do hope that we can maybe get to the point where people aren't having to work around the clock, because I know that there's burnout that's already happening with many different departments and staff, and I do think people have to pace themselves. So I hope that maybe if we're not at the crisis point, people, maybe we'll not have to do that. So, but I appreciate that, and I know burnout is something serious that we need to be aware of. So, and your staff works so much behind the scenes, and they don't get the credit from all of us and from the public. So please express our gratitude to everybody who's been working so hard. Thank you.
Thank you. I sure will. Thank you.
Well, Mr. Manager, I think that might be, I guess that's the end of this part of our agenda. I don't know if there's anything else that you wanted to say at this point, or?
No, I don't have anything else, Madam Chairman.
Okay. Okay. So we will move on in our agenda to the closed session. The board is requested to adjourn into closed session for the following: to discuss matters relating to the location or expansion of industries or other businesses in the area served by the public body, including agreement on a tentative list of economic development incentives that may be offered by the public body in negotiations pursuant to General Statute 143-318.11A4.
So moved.
Second.
Moved by Commissioner Reckow, seconded by Commissioner Howerton. All those in favor, please say aye. Aye. Any opposed? We're unanimously adjourned into closed session. And Monica, do you want to give everyone instructions about how we're doing this?
She should be logging back in. If not, we do have 4 commissioners on the line.
We have 4?
Yes.
If we have 4, we can close.
Roll with it.
Yeah, we can close.
Let's go with it.
Commissioner,
Chair Jacobs?
there she go.
Okay, so we have adjourned from closed session and given direction to staff. I would entertain a motion to adjourn.
So moved.
Second.
Okay, moved by Commissioner Hill, seconded by Commissioner Reckow. All those in favor, please say aye. Aye.
Aye.
Any opposed? And we're unanimously adjourned. I'm a little concerned. I don't see. Okay, Commissioner Carter's saying she doesn't hear anything.
Don't worry, we have 3.
I think we have 3. Okay, between the 3 of us. We've got a quorum.
Yeah, we
I
have
don't
a
know.
quorum.
Okay, we have a quorum. I don't even know if Commissioner Howerton made it on, but
Yeah,
we can let her
All
know.
right. Good
Okay.
night, everyone.
Good night.
Have a good
Okay,
night.
bye.
Good night.
Bye-bye.
Thank you, Monica and everyone.